So, how do you plan for health justice futures in a techno hellscape, especially when others don't seem to recognize or experience the same threats that you do?
I try to, I think, start by thinking about what people need to survive and live as fully as possible. And in the case of digital health technologies, which is my domain, what they need to sort of safely and effectively use technologies. And then I also think about how institutions and social systems tend to undermine those needs. And I try to work from that position. We have to speak to and act across multiple scales at once. At a professional level, for example, I tend to teach my students that I think we all have a normative obligation to um, sort of think reflexively about how our own actions may reproduce or disrupt harm in different contexts. I teach them to look for and try and identify inequity, even when or especially when it doesn't directly impact them. I teach them to think about the locus of change as something that exists within them and within the communities in which they reside, as opposed to a special set of actors who are sort of separate from them. And I think one of the key lessons that I try to sort of keep in mind in kind of planning for health justice futures is to really teach the students that the inevitability of these technologies is not something that we should presume, right? I think with a lot of AI-enabled technologies, for example, that introduce or sort of expand surveillance networks, there is a presumption that these technologies are already here, they pervade our lives. There's something that we just have to accept. And I question that at every turn and also encourage students to do that as well.